Good evening, guys. This is Felix Ruben, one of the very best YouTube presenters, actually. Welcome back to our YouTube channel. And today we've gone live here from City Hospital, actually, guys. Thanks for having been on the lead and having been making sure that we are following each other and we are learning some of these common conditions that are affecting our children, our, all modes of patients in the community. Thank you very much. So today, I just took a very small part of an assignment to actually deliver to you guys. Today I'm talking about, severe acute malnutrition. We are going to check into the 10 steps of how to approach what we call severe acute malnutrition. Most of the time, our patients do get themselves, most of the pediatrics, this is one of the conditions that put them down so much that if it is not properly managed, we end up losing most of our patients who have severe acute malnutrition. Now, we have 10 steps of severe acute malnutrition. These 10 steps, you really have to know how they flow chronologically. I'm going to give you a formula on how to master. As a student, you are not going to miss this in your exams. Now, I'm going to give you a formula on how you'll be knowing how to master the 10 steps with ease. Even in the exam room, you just write the 10 steps without having any problem. Now, this is what you're going to do, okay? Just have this formula, okay? Now, this is, just observe, this is H squared Dame, then cap, okay? H squared here, these are two steps, okay? And then P here, these are 2 steps. That is 4, 5, 6, 7, 8, 9, 10, okay? Now, the first H is hypoglycemia, okay? The first step is hypoglycemia. If you're not very keen with the patient, you might lose a patient because of hypoglycemia. Okay? These are patients with severe acute malnutrition. Immediately you receive these patients. Okay? A patient with mid upper arm circumference of less than 11.5 centimeter. That patient is eligible for getting admission for severe acute malnutrition. And basically, these patients, you'll actually observe the ABC rule. We have the airway, we have breathing, you have what we call the circulation, okay? These are patients that you really have to observe that ideology, okay? And then this is a patient, even if you don't have them work, but then when they are severely malnourished, just on the physical exam, this is a patient that you'll have to admit. These patients will come with, the Z score of, less than 3, okay? With edema that is more of bilateral, some will come with facial edema, and then you'll really have to check these signs and symptoms of kwashiorkor also, okay? That is the criteria before you do all this. Now, the hypoglycemia, you'll have to do random blood sugar, and random blood sugar is going to help you. If this patient is having hypoglycemia, you're going to know, okay? Now, hypoglycemia, RDS that is less than 3 millimole. This is a kid that is having hypoglycemia and severe acute malnutrition. This is someone you're giving dextrose. The dextrose you're giving here is 5 meals per kg of 10%. Okay, this will ensure that the child hypoglycemia state is well managed. At the same time, you'll have to manage by ensuring that the NG tube is fixed and the oral glucose is maintained accordingly. Okay? Now, that is the first H. The next H is standing for what we call hypothermia. Okay? Hypothermia. How will you know that your patient is having hypothermia? This is a patient you're just receiving, or a nurse in the triaging area has received a patient, and this patient is actually, in the triaging, center where you have the patient, or actually you've already know this patient is having some. Okay, just take your auxiliary thermometer and do check the temperature. The temperature less than 35, okay, degrees Celsius. This is someone having hypothermia. And hypothermia here simply means if you see the rooms where the acute rooms where the patients for severe acute malnourished children are, it's a room where it should be closed. Yeah, all windows are supposed to be closed. We should be having a heater there. These are patients who should be covered with warm blankets. There are patients who should be maintained properly with clothing that are supposed to be making them, never get themselves into hypothermia again. Okay? Now, that is hypothermia. The next step here is dehydration, okay? Now, dehydration here, this is dehydration. In dehydration, you have to be very keen, okay? The reason why you're going to be very keen in dehydration is because this is a patient you're receiving. They might be dehydrated until they get into shock. And you know how to know that this patient is having shock. We've discussed in the previous videos, okay? Someone having shock, capillary refill going beyond 3 seconds, okay? AVPU less than A, and this is someone with sunken eyes and the skin pinch and all those mechanisms that we use, the absent pulses, the weak pulses, cold hands. You already know that this patient is having shock. Now, in the addition part, in management of shock in severe acute malnutrition is managed differently. Okay? If the patient is having shock, then you will have to do IV fluids. The best fluid here is Ringer's lactate. Okay? If not in shock, manage with Resomol. That is the best type of management. And here, any patient that you're receiving with HP less than 4 grams per deciliter, never transfuse this patient. Okay? Never transfuse. But then if you are transfusing this patient, you'll have to do 3-hourly with 1 milligram per kg furosemide. Okay? The best blood for transfusion here is whole blood. That is 10 ml per kg. Okay? Now the next step here is what we call electrolyte imbalance. Here we are correcting electrolyte imbalance. Okay? And if you don't correct electrolyte imbalance, actually you lose this child very quickly. And make sure that someone that is having uh, electrolyte imbalances, never use furosemide. Okay, furosemide is never allowed for someone having actually edema. Never use furosemide. Now, electrolyte imbalance, we normally use the commercial 75. And commercial 75 is one of the best. If you don't have commercial 75, then you use mixed mineral plus maybe, 4 millimole per kg per day of potassium orals. Okay, and that is how you're going to manage the electrolyte imbalance, and you really have to correct. Guys, don't forget that if you are dealing with severe acute malnutrition, you have to correct all these steps, because each and every step counts. Okay, now the next step here is I. The I here is infection. Okay, guys, infection must be corrected here. And how you're going to correct your infection, how you're going to know that this patient is having infection. Definitely they have infection, but you have to prove. Several ways of proving. You can do full hemogram. You'll have the blood differentials, and you know that this particular parameter is derailed, and you're going to help the patient. Now, rule number 1, expert gentamicin must be maintained in first admission. And then Expen gentamicin is Expen is a very nice penicillin, and you really have to maintain it here. Okay, how you do your calculations, we had already done it in the previous videos, but then we may still repeat in the near future. Now, Expen managed with combined with gentamicin, and we normally do reviews after 48 hours. After 48 hours, you switch to amoxicillin, which is dispersible amoxicillin. Okay? Now, that will depend with how the patient is responding. Some patients will really respond in the 3rd days. Some patients may not respond. If they don't respond, you may switch to second-line treatment. And the second line, the best drug of choice is ceftriaxone. Okay? That will be what you will be using. Now, in the infection here, you will be having to check so many things. You might be having a patient with oral candidiasis. You'll be managing using nystatin. Okay? You might have a patient having, some of these eye signs of infection through the eyes. Some of these things, some of these infection signs, they may come even through the eyes. You're able to detect. Okay? You'll be using tetracycline eye ointment, will be good in that. And then after treatment, after the 7th day of treatment, you'll give albendazole, and that will be more specifically helping you in deworming and removing some of these worms that might be maybe affecting your patient. Okay? Now, in the infection part of it, management is based on response. If the patient is not responding, you'll be switching to another line, and most appropriately on the organisms that you are targeting. Okay? Now, from E, we have M. M is micronutrients. Micronutrients. You'll be correcting micronutrients here. Okay? And how you shall be correcting micronutrients is through vitamins, through multivitamins, through folic acid, through iron. But they don't give iron unless the child is well. Iron is a very, 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 very bad stuff. It may cause, and it may bring an environment where infections may seriously interfere with the child. Okay, despite of all those your managements. But then that is the same reason why you're there to look at this child. Are they improving or not? make sure that the right thing is done, and that's why we are studying all the steps so that you don't mess up. Okay. Now, next thing here is we have C. Okay. And C here we have cautious feeding. In cautious feeding here, guys, cautious feeding is one of the very important thing here, because you want this child to come out from the state of the malnourished scenario. You have to feed them cautiously, meaning that give them whatever they can tolerate. Okay? What they can't take, don't force them. Let them get what they can tolerate, cautiously, slowly. If they are unable to retain, if maybe you have some of these patients they can only feed on EBM, expressed breast milk, or some of this, maybe some of them are feeding on food. So you have to do it cautiously so that you make sure that they take it as long as they can retain, and what they can retain is what you give to them. You don't just force them. Okay? Another thing here is A. A here is active catch-up. Okay? Active catch-up. Their activity and how they catch up with the management and the treatment. Are they really active in making sure that whatever you're doing here, the response is now based on you, the doctor, and the guardian? Their response is based on you. That's why you're there to monitor each and every day whether they're responding or not. Another thing that is important here is the second last P, that is providing sensory stimulation. Providing sensory stimulation and emotional support. That is very, very necessary. That's why the mother must be here with the child. Yeah? By making sure that the children are here, they are supported emotionally, they're stimulated. Okay? And that is really well explained, and you really have to make sure that you do the right thing as per the protocols. Now, the last P, we had 2 P's. The last P here and the final is what we call providing follow-up. Okay? This is a situation that you're finalizing your treatment. You're making sure that the patient, once they're getting better, actually they're getting discharged. Okay? Are they followed? Is the patient being brought back to the clinic? How is the patient improving? Are they improving to drugs? Is the caretaker doing the right things as per how they were advised? So follow-up is key and very, very necessary, because follow-up entails so many things. Educational stuff, you have to teach them how to, make sure that the child is okay and safe. Guys, this is really cheap, So as a student, don't fail in this simple stuff. I'm making sure that you get the best content from the protocols and the new protocol that we have. Make sure that you have these things at your fingertips, so that whenever you are asked, whenever you receive a patient in a facility, a patient having severe acute malnutrition, you're able to manage properly and you're able to help this patient. And thank you for watching. Bye bye.